We welcome you to our module, Diabetes, with or without complication, HCCs 18 and 19 from MRA Tips. This module has been developed specifically for MRA reviewers as a refresher on diagnosis criteria, documentation, and coding of diabetes mellitus. At the end of this module, the learner will be able to identify the types of diabetes and their causes and symptoms. Note the different tests which are used to diagnose diabetes. Note the ICD-10 codes that fall under type 2 diabetes. Differentiate between documentation of diabetes with complication and diabetes without complication. Identify the types of diabetes that would be exceptions based on the documentation in the assessment and plan. Diabetes, also known as diabetes mellitus, is a group of diseases that affect the body's ability to respond to the hormone insulin and how it uses glucose. In the last decade, the number of people living with diabetes in the U.S. had an exponential surge of almost 50% to more than 30 million Americans. Normally, the pancreas releases insulin to aid the body in storing and using sugar from food. Insulin opens up the cells, allowing glucose to enter the cell. But with diabetes, this system doesn't work. Either the pancreas produces insignificant amounts of insulin, no insulin at all, or the body fails to respond to the insulin appropriately. The underlying causes of diabetes varies by type, but the bottom line remains the same. It leads to excess sugar in the blood, which can lead to serious problems. Chronic diabetes conditions include type 1 and type 2 diabetes, which are the most common types of diabetes. Type 1 diabetes is a severe form of diabetes. In this, the body doesn't produce any insulin at all. The onset of type 1 diabetes is more common in children and teenagers. On the other hand, type 2 diabetes is the most common form of the disease. In type 2, the pancreas will initially attempt to overproduce insulin, but, in time, will fail to keep up, causing blood to have a high glucose level. High levels of blood glucose can cause complications in other areas of the body, including the kidneys, nerves, heart, and eyes. There are other kinds of diabetes too, which can be potentially reversible. It includes gestational diabetes. Another diabetes-related condition, known as prediabetes, also exists. It means that the blood sugar level is higher than normal, but not yet high enough to be considered as type 2 diabetes. On the bright side, progression from prediabetes to type 2 diabetes isn't inevitable. Incorporating a healthy diet and an exercise regime can help the blood sugar levels to get back to normal. For the diagnosis of diabetes, we often use 4 tests, namely fasting plasma glucose test, HbA1c test, oral glucose tolerance test, and random plasma glucose test. Fasting plasma glucose test, or FPG, measures a person's blood sugar level after fasting or not eating anything for at least 8 hours. A diagnosis of diabetes is made when the fasting blood glucose is greater than 126 milligrams per deciliter on 2 separate labs. The HbA1c test measures the amount of blood sugar attached to hemoglobin. This test shows the average amount of glucose attached to hemoglobin over the past 3 months. We take a 3-month average because that's the typical shelf life of red blood cells. The result is measured in millimole per mole, but can also be reflected in percentage. If the HbA1c result is greater than 48 millimole per mole, or 6.5% on 2 separate labs, the diagnosis of diabetes is confirmed. The oral glucose tolerance test, on the other hand, was a common test for diagnosing type 2 diabetes, but is no longer routinely used. However, we do use it for gestational diabetes from time to time. The oral glucose test is performed after the FPG test, where the person receives a dose of oral glucose which is followed by a blood sample. If the reading is more than 200 milligrams per deciliter on a single test, the diagnosis of diabetes is confirmed. The last test on our list is the random plasma glucose test, or RPG, which measures plasma glucose levels. A small blood draw is taken at any random time of the day. Generally, it is performed when a person having serious diabetes symptoms has food or a drink and is unable to do the FPG test. When the result is greater than 200 milligrams per deciliter on one test, the presence of diabetic signs is confirmed. Note that the patient may have a combination of one abnormal HbA1c and one abnormal fasting plasma glucose test on 2 separate labs. Let's look at some common ICD-10 diagnosis codes for type 2 diabetes. When type 2 diabetes mellitus occurs with diabetic neuropathy, it is coded as E11.40, the HCC category being 18. When there is unspecified diabetic retinopathy with macular edema associated with type 2 diabetes, the code is E11.311, with HCC category 18. When type 2 diabetes is paired with diabetic amyotrophy, the condition is coded as E11.44, HCC 18. Type 2 diabetes with diabetic peripheral angiopathy with gangrene is coded as E11.52, HCC 18. When diabetes occurs without any complication, it is coded as E11.9, and the HCC category is 19. The assessment and plan should address the diagnosis and include 2 support indicators. Let's review an example for 2 progress notes. One with diabetes with complication and the other with diabetes without complication. For diabetes with complication, the report should look something like this. Patient name, Charles Vane. Date of service, January 19, 2019. Date of birth, January 23, 1956. Assessment and plan. Type 2 diabetes with complication of hyperlipidemia and PVD-A1C improved 6.0% to 5.8% per May 2018 labs. Continue metformin daily. Recheck A1C with next labs. Discussed stopping medication if A1C still well controlled with diet. Monitor. Diabetic hyperlipidemia, LDL, at goal with statin therapy. Continue simvastatin 40 milligrams. Next, let's take an example of diabetes without complication. The progress note for this would look like this. Patient name, John Silver. Date of service, February 13, 2019. Date of birth, December 12, 1967. DM2 without manifestations. Diagnosed on October 12, 2016, based on several readings of fasting blood sugars greater than 126 milligrams DL based on July 2016 till October 2016 labs. Controlled without meds. HbA1c 6.0 on November 27, 2018. Monitor lipids with HbA1c 6.0 every 3 months. Exceptions. While coding for diabetes mellitus, it is important to remember that gestational diabetes is an exception. It is classified as an exception because of its potentially reversible nature, as it occurs during pregnancy, but may be resolved after the baby is delivered. We have reached the end of our short refresher course on diabetes with or without complication. We gave you a short introduction to diabetes, discussed the types of diabetes, while focusing on their cause and symptoms, the various tests which are used to diagnose the disease, learning about the specific codes related to diabetes, and finally, the assessment and plan for diabetes with or without complication. Thank you for joining us.